How can you recognize cancer on your own, and what are the 9 most common signs of cancer? Watch this video until the end, because the last 3 signs are the most common. I already have a video on my channel where I talk about the main causes of cancer, but today I want to repeat that diet is the #1 factor. It is this unhealthy diet that leads to the development of a sluggish, chronic inflammatory process in the body. And what's most interesting is that chronic inflammation is always accompanied by chronic stress. Chronic stress is accompanied by chronic inflammation. A person gets caught in this vicious cycle, which they cannot escape on their own for several reasons. They don't want to, they don't know how, they don't have the skills, and they don't even look in that direction at all. Now let's move on to the signs by which you can independently recognize whether you have signs of an oncological disease. First, headaches. Frequent headaches that are not relieved by any analgesics. You take, I don't know, ibuprofen, you take something else, analgin, it doesn't help. You take Ketanov, which people take very often, right? It doesn't help, it doesn't relieve the pain. You need to urgently get examined, get an MRI to check if there's oncology, if there's brain cancer. They're called gliomas, glioblastomas. I personally conducted research in the field of glioma tumors when I worked in Germany. We conducted a study, and what's most interesting, I remember exactly how we did it, in vitro, that is, in a petri dish. I would seed 1,000 cells and leave them overnight. In the morning you come in, and these cells form what's called a monolayer, meaning all the cells are connected to each other. It's simply amazing. Literally, after 2 to 3 days, these cells, there were only 1,000 of them. And when you look at the dish under the microscope, you can barely see them. But after just 3 days, they cover the surface with such a thick layer, I don't know, about ½ a centimeter. That's how cancer cells grow. That's how they are constantly forming in our bodies, and it's important to know this. And if the immune system isn't working properly, these cells escape the immune system's surveillance. Plus, there are a large number of other factors, and that's when it all begins. That's how cancer develops. So, if you have frequent headaches, you should immediately get checked. If you have loved ones or relatives whom you care about and want them to live a long life, share this video so they can be informed as well. Because my father died of lung cancer at the age of 75. By the way, he was diagnosed at 70. And thanks to, by the way, super early diagnosis, because he had annual checkups, they did a chest x-ray, found a lesion, operated on it, and extended his life by 5 years. That's a very long time for lung cancer, because lung cancer usually develops without symptoms. And if my father hadn't smoked, I think he would have lived much longer. But he smoked and led a very sedentary lifestyle. He was inactive and ate a lot of sweets and fatty foods. Even though he was an incredible trauma and orthopedic surgeon who gave me so much in this life, I know for sure that there are mechanisms capable of stopping the development of cancer, but you have to start working on it much earlier. For example, here is a recent article from 2022. Regular anaerobic physical exercise reduces the likelihood of developing metastatic cancer by 72%. And if, in addition, you eat properly and drink enough fluids, then here you go, simple actions you can incorporate into your life for your own enjoyment. Not by forcing yourself, not through sheer willpower, but by gradually introducing these things into your life for pleasure. Steve Jobs, what did he die of? Steve Jobs died of pancreatic cancer, of the pancreas, a polyhematous organ. There were no warning signs at all until the pancreas twisted up, until he simply fainted from the pain. A very wealthy man who had access to any kind of medical care. They think, I've got tons of money, I'll just enjoy life to the fullest now, and then, when I start having problems, I'll pay up and they'll cure everything for me. Well guys, that's not how it works. Nobody's going to cure you just like that. Steve Jobs couldn't cure anything. He died at the age of, how old was he? He wasn't even 60, right? The second sign that you should never ignore is an increase in the number of moles, nevi, fibromas, yes, the appearance of fibromas, lipomas, or polylipomatosis. There is a condition where a huge number of these benign fatty growths accumulate all over the body. Well, they're benign, yes, you can have that nevus, that fibroma, or that lipoma removed. The surgeon will cut it out and send it for histological examination. You'll get a report saying it's benign, and you're like, okay, great, everything's fine, and you just go on with your life, right?
It's all good, I'm ready.
But this actually means there are serious malfunctions in the system that recognizes mutating cells. If such malfunctions exist, sooner or later this will lead to cancer. Here's the latest study. I was honestly blown away when I read it. Contrary to common sense, as they actually write there, the signal for metastasis, it happens when the viscosity of the intercellular fluid increases. So, what is the viscosity of intercellular fluid? Take a glass of water and add 9 spoonfuls of sugar. What happens to the water? It becomes viscous, right? Yes, it turns into a kind of gel. That happens either when you have a ton of sugars in there or when you have stagnant conditions, a swamp basically. And so, when a tumor grows, and they showed this directly, the tumor grows and compresses the lymphatic vessels, so not enough fluid comes in or drains out, and it becomes viscous. And as soon as this viscosity reaches a certain point, something happens. A signal for metastasis, and the cells just start metastasizing uncontrollably throughout the body on this viscous fluid. And even later, can you imagine, they tried to reverse the process, to reduce the viscosity, but it was too late. The point of no return had been crossed. The process was already underway. Body temperature that isn't connected to anything else. This indicates that the immune system is weakened. How should the immune system react? Either it responds instantly, like lightning, and the person doesn't even have time to notice that there were any temperature spikes at all. The second scenario is a sudden spike in temperature to 39 degrees Celsius or higher, but in this case it's neither here nor there. The immune system is doing something, trying to catch up to 37 degrees. It doesn't have enough strength to make a breakthrough, to neutralize everything. And the process turns sluggish, which creates ideal conditions for the development of a pathological state. Therefore, if you have a persistent, unexplained, relatively high temperature, what's called a low-grade fever, 37 plus 37.5, 38 degrees, then you need to urgently get checked, at least do a complete blood count. Fourth, liver cancer, lung cancer, pancreatic cancer, kidney cancer. This is all that occurs asymptomatically. These are parenchymatous organs. Parenchymatous. Parenham. What is parenchyma? Take a kitchen sponge. That's it. Our organs are the same. Parenchymatous, they seem to have the same structure, very similar. They have no internal nerve endings. They only respond when the capsule is involved, when everything has grown so much, become so large, that only then do some signals appear. How does this work? Blood in the urine, blood in the stool. By the way, I really recommend getting tested for hidden blood in the stool at least once a year. This is very important. It's possible to catch the first signs of cancer at quite an early stage by taking this kind of simple and inexpensive test. Fluorography, a general chest X-ray. This is something that everyone absolutely needs to do. The fifth sign is a change in skin color. Cancer patients are always very pale, and their skin has this earthy tone, almost like the color of earth. This first starts to show up under the eyes as dark circles. That's exactly the kind of earthy color they have. This is also one of the signs that something serious called cancer is developing in our body. The appearance of a specific odor. The Chinese train dogs to detect changes in odor. So in clinics, as one of the diagnostic methods, a dog comes up to you and sniffs you. Just like they train dogs to detect drugs, they also train them to detect cancer patients. What else bothers me about modern medicine right now? It's that we've now handed over the detection process to machines. Now we have MRI, we have ultrasound, we have, X-rays, right? All of this is necessary, absolutely, 100% necessary. But because of this, modern young doctors are losing their logical clinical thinking altogether. That is, they no longer correlate things like a sallow skin tone with a change in smell or other signs. It's all just about the MRI result. Well, not just the MRI, right? They might simply miss something because they overlooked these subtle changes in a person, like the ones I talked about today. And there are 3 main signs that appear in a person when the oncological process is already underway. The first is blood loss, right? In other words, anemia. This is a sharp decrease in the number of red blood cells in the blood. Why do we need red blood cells? We need red blood cells to transport oxygen to the tissues, to the organ tissues. That is, what develops is so-called chronic hypoxia. For women, the normal level should be 115 grams per liter, and for men, not less than 130 grams per liter. That's the amount of red blood cells that should be present according to a complete blood count. So the simplest thing is to take a complete blood count with a leukocyte formula. Everything will be very clearly visible there. On my Telegram channel, I will definitely post the list of tests, the checkup that I regularly do myself and recommend to my patients. This is so you can understand what is happening with your body right now and prevent the development of any serious diseases such as cancer or cardiovascular diseases or anything else. The link will be in the description, so go ahead and grab this list there. The 8th sign is also very important. Suddenly, for no apparent reason, a person starts losing weight, unexplained weight loss. There are several possible reasons why this happens. Cancer is the #1 cause. That is, if a person suddenly starts losing weight for no reason, without any changes in diet, lifestyle, or anything else, there is a very high probability that it is cancer. Therefore, you need to get examined urgently. And the first thing you need to do is a complete blood count with a leukocyte formula. That's the very first step. And you definitely need to check your C-reactive protein as well. And the 9th sign is increased fatigue. So what is increased fatigue? It's when you take just a few steps and already feel tired. It starts gradually. If you wake up already feeling tired, these are echoes of some serious inflammatory processes or malfunctions that could lead to cancer. With a very high probability, they will lead to it. Therefore, if you have increased fatigue, you need to think about it and understand that you should get examined.